So a 35-year-old man visited my clinic with complaints of inability to ejaculate or produce a semen sample. He had been married for the past 6 years and he was facing this issue for the past 5 years. On asking if he feels orgasm during the ejaculation process, he responded positively. On going through his medical history, he was diabetic for the past 8 years. His recent sugar values reflected a high glycemic index with high fasting, postprandial, and HbA1c levels. On examination, he was well androgenized with bilateral normal sized testes and phimosis was ruled out. I then asked him to produce a semen sample, but this time in a near empty bladder. He was instructed to produce a semen sample first and then collect the post-masturbatory urine in a separate container. As usual, per his complaints, he failed to produce any forward ejaculatory semen sample. But when his post-masturbatory urine was analyzed, plenty of sperms were found. But all were immotile. It is a condition in which the man fails to produce a semen sample all totally, which is known as complete retrograde ejaculation. And in some cases, the man may be able to produce semen sample, but in low volume. This is known as partial retrograde ejaculation. In all these cases, the semen sample, which fails to ejaculate forwardly, goes back into the bladder and gets stored in the urine due to the weakness of internal urinary sphincter located at the neck of the bladder. Mostly this condition is faced by patients who are diabetic, who are hypertensive but on medications such as alpha blockers, patients who have gone for prostate surgery via the transurethral route, and cancer patients who underwent retroperitoneal lymph node dissection. In some cases, this can be helped with medications such as sympathomimetic drugs, ephedrine, pseudoephedrine, and anticholinergic drugs such as imipramine, which can help strengthen the internal urinary sphincter located at the neck of the bladder. In other cases where these medications fail to give adequate results, we need to alkalinize the urine with the help of soda bicarb or acetazolamide tablets. Sperms, which are live and motile, can then be retrieved from an alkalized urine and processed to be used later for intrauterine insemination or for IVF and ICSI processes. This is Dr. Suchismita, and if you are facing any of the above problems, you know where to find me.